Hi sir, what are you doing?
Oh, sorry. Actually, I'm just looking around here.
I see. Do you feel free right now?
Of course.
Do you want to know about strabismus?
What? Strabismus? Can you tell me?
Oh. Do you want to know the detail of the strabismus, sir?
Yes, of course.
Okay, come. I show you the detail about strabismus.
Okay.
I find a great lighting and a squint of eye for makes everyone look better. So it is a quote from Cat Dilly. Hello, my name is Farish Rizkin Akla bin Mohammed Saleh. I'm from group BA09. So my metric number 2023 305 551. So I'm from BA232. I will inform to you guys about strabismus. Before that, did you know one of the famous person in Malaysia is a strabismus patient? But who is that person? That person is the Raja Pemaisuri Agong. Raja Pemaisuri Agong Tunku Azizah Aminah Maimunah Iskandaria spilled the tea through her Twitter because Princess Afghan had gone viral. So it is about her photo taken posing at Ma'al Hijrah while glaring. So Tunku Azizah was wear a glasses from age of 3 years to 12 years old to correct her eyes. So after Tunku Azizah's eyes are back to normal, she did not wear glasses anymore. Same to her child, Princess Afghan, from age of 3 years old to 13 years old, use binoculars. So my mother and child be the same. It is not water queen but a surf queen. So let's move to the next part. We move to the next part. Before that, I want to ask you guys, do you know about strabismus? Strabismus, or better known as crossed eyes, is when your eyes are not lined up properly and they point in different direction. One eye may look straight ahead while the other eye turns in, out, up or down. The misalignment can shift from one eye to the other. This statement I was found by Michael Puente Jr. His specialty in ophthalmology and strabismus. One or both eye may turn either in what is called esotropia outward is called esotropia, upward is called hypertropia, and downward is called hypotropia. So for the central idea, strabismus can cause a few problems including blur or double vision, depth perception problem. There are a few treatments available for strabismus, including glasses, primism, and surgery. So, treatment is most effective when started early in childhood. Ladies and gentlemen, now we move to the percentage of having strabismus. Percentage of prevalence strabismus in Hong Kong children I study, 4,273 children receive comprehensive ophthalmological examination. Through questionnaire, information about prenatal and postnatal background, parental smoking habit, and family history of strabismus was gathered. The result was found among 133 children strabismus patients. It consists of 117 children is exotropia, which is 87%, 12 children exotropia cases is 9%, multivariate analysis relief of strabismus with myopia 3 children around 3%, and hypertropia 1%, which is 1%. So moving to the causes, strabismus eye disorder occurs when they are a problem with a muscle controlling your eye movement. Any abnormality in neuromuscular control of your eye can lead to eye misalignment. I have a few causes. For example, the first one is disordered children. It is affecting in the brain that can lead such condition include Down syndrome, cerebral palsy, hydrocephalus, and brain tumors. The next one is neurological muscle. This causes by weak muscles around their eyes and just are not strong enough to keep their eyes aligned. The last one is a genetic. Genetic is a higher risk of history of eye misalignment. But it is not a guarantee. However, sometimes the gene is passed down and sometimes not. So we move to the next part, which is the treatment of having strabismus. I also have a few treatments for strabismus patient. So the first one is eyeglasses. The standard of care for treatment of accommodative esotropia. It can help some people with mild double vision see one image, not two image. The second one is eye muscle exercise. The patient can learn technique from an ophthalmologist to help concentrate both eyes inward. The third one is Botox. In order to keep the patient's eyes to aligning properly, strabismus can be treated by an injection of the medication into eye muscle. The improvement in eye alignment may be permanent or it may only last a few months. And the last one is surgery. Surgery is a standard of care for moderate to large angle esotropia as well as anomalous head posture. So an ophthalmologist can loosen, tighten or move certain eye muscles so that the eyes line up properly and work together. Before I end my speech, I want to make a conclusion. So cerebral palsy is disorder characterized by abnormal posture and movement. So Raja Permaisuri Agong and her daughter are also one of a patient strabismus. So a few symptoms of having strabismus. The first one is eyes that don't look in the same direction at the same time. The second one, eyes that don't move together. The third one is squinting or closing one eye in bright sunlight. The last one is bumping into things. So parents, teacher or doctor, if found this patient during their child, must get treatment as fast as lighting. So if successful correct at early age, not only are the risk of strabismic amblyopia diminish, but peer acceptance and personal self-esteem are increased.